Hi, we're going to be talking about fentanyl, which is an opioid analgesic agonist. So, when are you going to use fentanyl? It's going to be used for surgical anesthesia, chronic pain, breakthrough cancer pain, and sedation. So, if those are the main uses, then you already know that there's pain is more than your typical headache. They're going to be sedated. And so, okay, if they're sedated, then what are we watching for? We're watching for respiratory depression. And if you're using it for sedation, then obviously sedation is another side effect. You're also going to see muscle rigidity, constipation, urinary retention, and nausea. So, let's look at how you can give it. You can give it in a couple of different routes. One of the ones you're going to see in the hospital a lot is you're going to see the parenteral, which is going to be IM or IV. That's usually for the induction or maintenance of surgical anesthesia. And this is well suited for these applications because it's got a rapid onset and a short duration. The effects are most like morphine, but it can cause muscle rigidity, which can interfere with the induction of anesthesia. And so on this, then there you can also have the patch. The patch is what I seem to hear a lot about, and it's going to be applied to the upper torso of the skin, and the drug slowly releases from the patch and is absorbed through the skin. In 24 hours, you're going to have effective levels, and then they stay steady for another 48. So every 72 hours, you want to be switching the patch out, and then you want to be folding and flushing and making sure you store it. Now, you want to make sure that this is only used for persistent severe pain in patients who are already opioid tolerant. If they're not already opioid tolerant, it could be fatal, and they could go into respiratory depression. It should never be used in children under the age of 2, or if you're over 18, you shouldn't use it if you're under 110 pounds. You also want to remember that if you have intermittent pain or you can use something else, that's the route that you want to go. There are lots of precautions if you use the patch because it is so strong. So if you're on the patch, you cannot take it if you are not opioid tolerant. You don't take it for intermittent pain or if you can respond to a less powerful drug. If you're an alcoholic, delirium, tremors, convulsions, intracranial pressure, head injury, no AMIO inhibitors, and within 2 weeks of therapy even. You shouldn't use it if you're nursing or in labor and delivery. Now, for IM and for parenteral, for IM and IV, for labor and delivery, you are able to give one shot of fentanyl to laboring moms, but you want to make sure that you are monitoring the baby because it could drop their heart rate. And for muscular rigidity, it's not recommended for breastfeeding unless it's just a single dose. But then you're still monitoring the baby for respiratory depression. Now, there are other ways that you can take it. One is a transdermal ionotropic system. It is a needleless. It's a lot like an IV pump. It delivers the same way and it has the same effect, but this is just a needleless system that's done through electrical pulses. Now, transmucosal, these routes are going to be for your breakthrough pain. These are cancer patients, severe pain, and so for these guys, you have to be at least 18-year-olds and you're already on opioids around the clock, but you have developed some degree of tolerance. These people are going to most likely experience some dizziness, anxiety, confusion, nausea, vomiting, constipation, dyspnea, weakness, headache. The biggest concern is respiratory shock and depression. There's several ways that you can get this kind. There's like lozenge on a stick. You can take buccal tablets, sublingual sprays, sublingual tablets, and it can be intranasal. And like I say, these are for those people who just aren't getting pain relief anywhere else, but they've already developed some opioid tolerance. Now, as a nurse, you're going to be wanting to monitor their blood pressure, their respiratory status, heart rate. You also want to look for the effectiveness of the pain. Is their adrenal gland functioning below normal? You need fall prevention in place. They're very sedated. You're assessing their physical dependence. You're managing the side effects such as nausea and vomiting, and you're watching for the excessive sedation and constipation. You also want to monitor their liver functions with this. And as far as patient education, you want to make sure that they know that they may experience dry mouth or diarrhea, headache, sensation of cold, lack of appetite, insomnia, they're sweating a lot, abdominal pain, tingling of the mouth. They need to report immediately if they have slow breathing, shallow breathing, difficulty breathing, severe dizziness, passing out, illogical thinking, severe nausea, vomiting, severe constipation, loss of strength and energy, shortness of breath, angina, tachycardia, bradycardia, severe fatigue, seizures, severe mouth irritation, mouth sores, severe application site irritation, swelling of arms or legs, swelling of hands or feet. Educate patient about the signs of a significant reaction. Those are just your normal allergies, wheezing, chest tightness, blue skin color. Remove the old patch before applying the new one to avoid overdosing. Once the patch is in place, it must not be exposed to direct heat, such as heating pads, hot baths, electric blankets, because doing so can accelerate the fentanyl release and can cause fever, as can fever, sunbathing, and strenuous exercise. You want to change the patch every 72 hours or 48, depending on what the provider orders. If it's used or damaged, it needs to be flushed in the toilet for proper disposal. Used patches should be folded in half with the medication side touching and flushed down the toilet. Unused patches should be stored out of reach of children. Intranasal fentanyl patients should allow 2 hours between doses, and if more than 5 doses have elapsed, or 5 days have elapsed, you need to discard the bottle and replace it with a new one. Fentanyl concentrations may be increased by grapefruit juice, so to manage that, you need to avoid taking intakes of large quantities. So keep it to less than a quart a day. No operating heavy machinery, and educate about storing the medication safe so it doesn't fall into the hands of accidental or illicit ingestion. In addition, remember, if a patient starts to develop respiratory depression or the effects are getting too bad, you can always use naloxone. It is an opioid. It is the antidote for opioids.